Healthy People 2020 defines mental health as a state of successful performance of mental function resulting in useful activities, gratifying relationship with other people, and the ability to adapt to change and to deal with challenges. According to Healthy People 2020, mental disorders are among the most common causes of disability. In addition, the resulting disease burden of mental illness is among the highest of all diseases. In 2014, about 1 in 5 adults aged 18 or older had a type of mental illness in the past year, and 4.1% had a serious mental illness. The percentage of adults with mental illness remained stable from the year 2008 to 2014. Cock et al. Conducted a quantitative randomized controlled trial for a duration of 3 months to determine the effect of internet-based cognitive therapy with monitoring via text messages, in addition to treatment as usual. Remitted patients with at least 2 previous episodes of depression were randomized to mobile CT in addition to treatment as usual or treatment as usual only. Depressive symptoms were assessed using the inventory of depressive symptomatology at baseline, at 1.5 months and 3 months after randomization. Study findings by Cock et al. Revealed that residual depressive symptoms showed a small but statistically significant decrease in the intention to treat group over 3 months in the mobile CT group relative to the treatment as usual group. The effect of the treatment condition on the depressive symptomatology at the 3-month follow-up was small to moderate. All analysis among completers showed more pronounced treatment effects, and adjustments for unequally distributed variables did not markedly affect the results. Van Beek et al. Conducted a randomized controlled trial to determine the effect of brief CBT in reducing anxiety and depressive symptoms in patients with non-cardiac chest pain and comorbid panic and/or depressive disorders. The intervention was based on the theory of cognitive model. Patients were randomly assigned to either a control group with usual care or an intervention group. A 24-week randomized controlled trial was conducted comparing brief CBT with treatment as usual in patients presenting with non-cardiac chest pain. Treatment as usual was tailored to the individual needs of the patients. The treatment as usual group did not include psychotherapy, CBT, or antidepressants. CBT consisted of 6 individual sessions with a duration of 45 minutes. The CBT protocol was based on the cognitive model developed by Clark. Study findings by Van Beek et al. Revealed that, in accordance with the hypothesis, CBT was found to be superior to treatment as usual in the improvement on the primary outcome measures of severity after 24 weeks. In addition, on the secondary outcome measures of anxiety and depressive symptoms, CBT showed superior results compared to treatment as usual. These findings were in line with findings of 5 previously performed trials evaluating psychological symptoms. The everyday challenges confronting the nurse practice compel nurse practitioners to justify their clinical decisions. Therefore, nurses who base their clinical decisions on scientifically documented information act in a professionally accountable manner and help define the identity of nursing and promote excellence in practice. The findings of this literature review are in line with the findings of previous performed trials evaluating the helpfulness of CBT and its use as a treatment for patients with depression. Both studies demonstrated that patients treated with CBT have a decrease in depressive symptoms. Therefore, if clinicians use CBT as a form of treatment for patients with depression, it will not only benefit the patient, but will also improve the nursing practice. National authorities have estimated that about 1 in 5 adults aged 18 or older have had or will experience an episode of depression. Although there have been advances in the usual treatment of depression, there is no evidence that the depressive symptoms have lessened, and as a result, the clinician is confronted with a puzzling situation. In addition, not all depressed patients respond to treatment as usual. Many patients who might be responsive to treatment as usual either refuse to take the medication because of personal objections or develop side effects. Therefore, based on findings of this review, CBT will be a proposed evidence-based intervention in the treatment of patients with depression in an outpatient setting, such as an outpatient mental health facility. In addition, the study of Koch et al. Showed the effectiveness of mobile or internet cognitive therapy, which can be applied in the treatment of patients in hard-to-reach rural areas.